Are you worried that you or someone close to you might be suffering from schizophrenia? This short film will help you to understand the symptoms of this complex illness. You will also see how schizophrenia affects lives and what to do if you suspect someone you know is experiencing the symptoms of schizophrenia. Schizophrenia affects between 1 and 2% of the world's population. It touches both men and women equally and can present itself in different ways. Symptoms typically emerge in adolescence or young adulthood. Schizophrenia is not the result of a single issue, but it's thought to be caused by a combination of various factors such as genetics, infection of the fetus during pregnancy, brain injury at birth, social isolation, the use of certain drugs such as marijuana, and stress. A patient that combines these factors has an increased risk of developing schizophrenia. Let's have a closer look at the symptoms. Schizophrenia is typically associated with disruption of thought processes. The main categories of symptoms with schizophrenia are positive and negative symptoms, cognitive symptoms, and mood symptoms. Positive symptoms are symptoms that are not experienced by other people, so they appear to be added to the patient's normal behavior. They can range from disordered thinking and unusual speech or behavior to delusions and hallucinations. Negative symptoms, however, refer to types of behavior that have diminished or have been removed altogether. For example, people with schizophrenia may avoid social contact, lack drive, or show no signs of normal emotion. Cognitive symptoms refer to problems with attention, memory, and the executive functions that allow us to plan and organize. Mood symptoms include feelings of depression, hopelessness, suicidality, as well as general mood swings and dysphoria. Coping with the symptoms of schizophrenia is difficult, not only for the patient, but also for family members and friends who now have to support and witness the effects of the illness. This is even more difficult when you can remember the person before he or she became ill. Now, if you think you recognize some typical symptoms of schizophrenia in yourself or someone close to you, talk to your doctor as soon as possible. Only a medical professional can make a proper diagnosis. But it might also be helpful to bring in a symptom checklist to facilitate his assessment and speed up the initiation of the right treatment. Early treatment increases the chances that the symptoms won't get worse and that the patient can take control of his or her life again.